Good afternoon, everyone. I am glad here. I'm going to talk about my project, which was a very interesting project. So I worked for UMASH in the School of Public Health. UMASH focus is health and safety in agriculture. And UMASH is one of the 11 centers funded by NIOSH. Now, what are the dangers that the dairy farm poses to a worker? And animals, large animals. Large animals can weigh easily over 1,000 pounds. And you can name anything that can happen with a large animal, broken bones, broken ribs, bruises, many things. And also working in dairies for many hours. Dairy workers in many dairies work 12 hours a day, 6 days a week. And sometimes they use the same arm to operate the milking unit. And that can degenerate their nerves, and later on they cannot use their arms anymore. So that's a danger. And also other things such as diseases from handling animals, needle stick injuries is something common also that happens with workers that vaccinate cows. Other things that can happen in dairy farms, machinery. Accidents with machinery are very serious, and it can be fatal. So, and we can read in the newspaper about accidents with machinery. Toxic chemicals are used in dairy farms. The one that I have in the slide is about the food bath of cows. Inhaling those fumes can have long-term impact on the health of workers, and that can be very serious injuries, diseases. So what happens in the United States and in Minnesota is that dairies are decreasing in size, decreasing in numbers, but increasing in size. That means that there are many more cows. There are hundreds of cows, sometimes farms with thousands of cows, and that needs more labor. So dairies are, in order to meet their labor needs, are hiring immigrant workers. And can we think about the vulnerabilities of a population that comes to the United States without training, without speaking the language, without knowing their workers' rights? So it's a population that's highly vulnerable, and they're increasing in numbers. And farmers tell me that they're happy with their performance because, well, they come here to work, so they put most of their effort in working. But the injury rate in dairies is high. So the need was there to create a curriculum that could provide culturally appropriate training to dairy workers, and that could train these workers because they needed training. So two partners of UMASH, collaborators, Migrant Clinicians Network and the National Farm Medicine Center, develop and implement a training called Seguridad en las Lecherías, safety on farms, and to provide culturally appropriate training and to give all the basics, to train workers. So what we have here on the slide are those trainings. I interacted with workers in 19 dairies. I went there for 5 times to each dairy because we have 5 lessons at each training. So what was important for me is that workers are very smart. They really know what dangers they're facing, so they know. My job was to engage them to think what dangers they face and how they can prevent those accidents. And not only thinking about themselves, changing behavior, but also thinking in terms of the farm. What are the hazards that the farm offers and what the farm can do in order to increase safety on the farm? So that was really an important thing for me to understand and to engage workers. The main thing that was very satisfying is to get them to speak. And they can speak about the hazards. But also something important that I learned from these trainings is that training the working is very important, but it's not enough, because they need to be able to voice their concerns. They need to be able to talk to the farmer, to talk to management, and to explain what are their concerns without fear. So support for the worker is very important. So training the farmer is crucial, we need it, but also training the farmer, training management, so they know how important it is to train workers, but how important is that they support the worker. So we can advance together and they can plan and improve safety on the farm. So what, just briefly to say, because the slide is over, but I gave a few questions to the workers before each training. And we had an evaluation of the scores after that, and we saw that it was statistically significant, the knowledge gained by workers after each training. We also conducted, or I interviewed farmers and workers before the trainings began and at the end, and we had positive results. Workers learned, and farmers said that there was a change in behavior, that workers' safety and also the safety culture improved, as well as teamwork. So it was a very satisfying work, and I learned a lot from that. So what I have there at the end is, yes, we can, sí se puede. Thank you.